About how the rate of attempted suicides amongst young people is higher in Lubbock than almost anywhere else in the state. That brought back up a very important discussion over mental health resources in our area. But over at Covenant, they tell us while it might not be talked about much, mental health care is still one of their key missions. Lubbockites' Brenshavia Jordan finds out what that exactly looks like.
Covenant Hospital offers a variety of resources for people in the community to make sure they have the support they need emotionally, physically, and mentally. Whether it's a new mom dealing with postpartum depression or someone dealing with chronic illnesses, there are physicians in place ready to help people function in a healthier way. According to postpartum depression statistics, approximately 1 in 10 women will experience depression after giving birth, and 50% of mothers are not diagnosed by a healthcare professional. Mental health counselor Kara Pepper supports mothers in the intensive care unit daily and says many don't know how to cope with depression.
There's so many people that just don't know what that means. Answer questions as to why, answer questions as to how we cope with it, provide them resources, whether that's Sarah on the outpatient side or other community counselors, psychiatrists, anything that they need. I try to be the person that sets them up for success in their postpartum period.
Psychologist Dr. Valerie Johnson works with diagnosing and treating behaviors and says the most rewarding part is giving patients the tools they need to function healthier.
I had a lot of people in the community tell me, hey, this is really surprising. This is not what I expected. This was really helpful. My relationships with my family members have improved. My relationships with my significant others are improved, and that's just priceless for them.
The Covenant Counseling Center also offers therapy for the whole family starting at the age of 3, focusing on people in the community who do not have insurance.
We work on the goals that they set up at their initial appointment, and then we revisit them throughout their time here. And once they're ready to move on, they are able to do so with the opportunity to come back as well if they need to.
Mobile integrated healthcare is another resource where paramedics work closely with physicians and visit the homes of patients so they don't have to go to the emergency room.
We have been able to recognize oncology patients that were septic, that is, had bacteria in their bloodstream, a potentially life-threatening condition, and get them to the hospital much more quickly than we might have had they had to wait to get in to see their physician or even go to an emergency room and get their care.
Dr. Robertson says the program and many others are hidden gems, and more people in the community should know about them. Brenshavia Jordan, KLBK News.